you don't have to wait 5 years before you go into something more comprehensive. I think there's that sort of stigma drilled into us from dental school in that there's a natural progression when we graduate. It's do your time, do basic restorative and hygiene work. And then when 5 years has passed, maybe you start to look at more complicated things, whether it's specializing or gaining a special interest or becoming a dental practice owner. I have a problem with that. Like, I don't think that's necessarily something you have to do. Being in a practice where you have a mentor or a coach, not where you can just call them in occasionally, but where you have dedicated time to talk to someone. I think someone to talk to routinely is important. Just to open up and just say, hey, look, feeling a bit vulnerable right now. I just need to, bend your ear for a moment and talk about it. I think you need to find that workplace where you don't have that moment of transition where whether you're walking into work or you're walking out of work, you feel the same. That's important. So when people say work-life balance is a struggle, typically in dentistry, it could be a sign that either that culture is not for you, or you need to work on your mindset or work on cultivating a mindset that's going to improve your perception of things.
CPD Junkie Dental Podcast is about connecting with passionate Australian dentists who are improving themselves and have attended various CPD courses. My aim is to find out for you the best CPD courses around and what they did to help get them to where they are today. So you can consider doing it and becoming the best dentist you can be quicker. Hi CPD Junkie fam, I'm your host Dr Laurence Doan, and today we're joined by Dr Johan Weemaes. He is a principal dentist at the Avenue Dental on the Sunshine Coast. He was the graduate of the year in 2014 as part of the first graduate of the year program. Since then, he has grown a team of 8 dentists throughout mentorship and giving back to the next generation of dentists through the Australian Graduate of the Year program with Avenue Dental. Since graduating, his focus has been on full mouth rehabilitation, cosmetic dentistry, and dental implantology. Currently, he runs an introductory program to implantology in conjunction with DIO implants. Dr. Johan, welcome to the show.
Thanks for having me, mate. I appreciate your time.
So tell us about your CPD or dental journey so far, especially into full mouth rehab, cosmetic dentistry, and dental implantology.
Sure, mate. Well, I graduated in 2014 from Brisbane, the University of Queensland. And I remember entering this competition, the Avenue Dental Graduate of the Year Awards. And I didn't think much of it at the time, but I submitted an application and I was fortunate enough to be accepted and be the first winner of that program. And Steve and Eli, they're the owners of Avenue Dental, and the initiative is really just trying to give back to the next generation of dentists. But what it actually was like the start of my journey with Avenue Dental. So I was actually working in Brisbane at the time for a small practice, and when I entered this award program, it's actually a mentorship program which goes over a year, and Steve and Eli run it. It's done, just given out of their own time, and it's all about just trying to give them practical hints and tips in everyday dental practice, in private practice specifically, all the way from restorative, crown and bridge, all the way up to like full mouth rehabilitation work. But really what it did for me was sort of inspire me and motivate me to kickstart my CPD journey. It was only like probably 8 months later that I actually joined the Avenue Dental team. And then that really kickstarted my CPD journey in a lot more, in an accelerated form. So I suppose CPD for me, it begins with the sort of philosophy of like begin with the end in mind. And that's not something I've come up with. That's from Stephen R. Covey's 7 Habits of Highly Effective People. And it's just, I sort of had to picture myself in the future and where did I want to end up and what were the steps I had to take to get to that end point. And really when I worked in my private practice in Brisbane, the principal dentist there at the time, he specifically worked on implants and implants alone. And I was really inspired by that. And I noticed that he was busy, he loved his work, and it was really life-changing. And I'm not saying that general dentistry is not life-changing for our patients, but probably implants really made quite a dramatic change compared to what I was doing, with just general restorative and hygiene,
Yeah.
So that's for me, that's when I said, that's what I want to do. That's the end result. So what do I do to take those steps? So in the first few years, I did spend a lot of time and my initial earnings in CPD, I probably did spend a little bit more time studying rather than working. And you got to find that balance. But for me, it's just head down and trying to get the most I can out of these courses. I think I started my journey with a lot of Lincoln Harris's programs. So initially, I was one of the first guys to do Lincoln Harris's course continuum, which was like a year long, we'll call it a residency, covering different modules. And some of it was related to full mouth rehabilitation work, crown and bridge, restorative. But it did go into soft tissue grafting as well. So it covered a few different bases. That was fantastic. Lots of different lecturers were involved, including Lincoln. And as we all know, he's an inspiring, practitioner himself. So that was an eye opener. I took a lot away from that, and I could implement a lot in my private practice. I then moved more specifically to implants quite quickly. So this is hard because implants and ortho are sort of those two niches where the journey never ends. Like it's just, there's no one course.
Yeah.
But for me, I dabbled in little weekend programs, but I tried to do the more comprehensive ones as well. So where I went with implants, I did the MIS overseas hands-on training in Colombia, specifically in Bogota, Colombia. I did that with some colleagues, and that was, as you can guess, just placing implants, just getting straight into it.
Yeah.
And that was fantastic. That was really just to get an idea of hand skills and a feel of bone densities, working with your first implants and working with patients and trying to ease their anxiety around the procedure. Given the language barrier, not easy,
Yeah.
as you can imagine. But that was phenomenal. As you can imagine, hands-on programs are always the case. So the obvious problem then is the gap in the theory. So as I said, there's no one program which covers like everything in implantology.
Nice.
So we had the hands-on skills that you could develop there. Really from there, I jumped online. Everyone sort of seeks information from PR, of course, on Facebook. And word of mouth is really strong, I suppose, for Kenneth Lee in Sydney and his International Academy of Advanced Dentistry.
Yeah.
So I did his year-long residency in implantology. And honestly, I can't speak highly enough of Ken. He's the most humble man, but just incredibly successful, but just willing to give back to the next generation of dentists. And his program is the one I recommend, even though I run a small implant program myself. I just blatantly push everyone to his as well, because it's just like he gave so much to me. So I want him to, see, the next generation of dentists see him as a pioneer as well.
Yeah. I'm going to pause you for a second there, yeah?
Yeah, go for it.
So, I mean, obviously, we all graduate, right? And if you're graduating in this kind of day and age, you're on Instagram, you're on social media, you're flicking through, you're seeing everyone, you're seeing all these great clinicians, some of the young clinicians, they're posting like full mouth rehabs, I want to, obviously, at your time, when you were saying you graduating, you kind of dumped into something that was quite extensive, such as what you've mentioned, Lincoln Harris's, continuum. I mean, looking back now, would you say, that would be something that you would encourage, or, what would you say about that?
Oh, that's a really good question, mate. What I always tell my associates is you don't have to wait, 5 years before you go into something more comprehensive. I think there's that sort of stigma drilled into us from dental school, in that there's a natural progression when we graduate. It's do your time, do basic restorative and hygiene work. And then when 5 years has passed, maybe you start to look at more complicated things, whether it's specializing or gaining a special interest, or becoming a dental practice owner. And I have a problem with that. Like, I don't think that's necessarily something you have to do. So for myself, my mentors at the time were at Avenue Dental, Steve and Eli, and I just had opportunities placed in front of me thanks to them. And one was becoming a dental practice owner within the first sort of 18 months of graduating. But then just pushing me to do the more complex things. So like a full mouth rehabilitation. So opening, vertical dimension, dual arch, crown and bridge, and implantology, so granted, I had incredible mentors, so I can't say I would have been as courageous if I didn't have those mentors.
Yeah.
But I don't think we should hold back, when we graduate. We have to have a supportive, safe environment to of course advance our scope. But
Yes.
if we have that, I think it is something where we can push, within the first few years to expand.
Yeah. Well, I mean, like the other thing I pose to you is, and you can share your thoughts on this, is, a lot of the courses we pick might be something that we aspire to want to do. But sometimes when we go back to practice the next day, we don't see these kind of patients, straight up. So, I mean, what are your thoughts on that? And yeah.
That's a really good point, mate. Yeah, it's true. We always come from these programs, wide-eyed and ready to go, ready to get a scalpel out.
Yeah, because a lot of our listeners are probably going to listen and they're like, yeah, okay, I'm going to go sign up for something that's quite intensive. But then, they come back and they're like, wait, what happens now?
Yes, yeah, that's true. That's true. Yeah, look, I must say it's a slow build. So, I mean, per year, I might place something like 200 implants, but initially it was one implant a month. It was a very slow build, and honestly, it probably comes down to communication and sourcing those patients. So if your dental practice has marketing and you have the good communication processes and skills to seek those patients, you'll get to that point, but it is a slow build. Yes, it doesn't happen definitely overnight. That's true. That's true. But it does happen. It does.
And the next thing I want to go into is, so after you dive into something like a continuum like that, and that, you've been given in a situation where you've got the support, you've got the patients, you've got the right environment to kind of implement, everything that you would like to do at this point, right? A lot of graduates now, they're talking about, I want to do ortho, I want to do implants, I want to do all to kind of learn it all together at the same time. I mean, for yourself, you obviously dived into, after full mouth, you dived into implants. What would your take be on that?
Yeah, really good question, mate. And this is something I'm quite passionate about. Is I specifically identified implantology as the end result that I wanted to go down. And for myself, I didn't want to go halfway. Like, I wanted to go to the full extent where I didn't have to refer out. And that wasn't from a selfish perspective. It was more so I didn't want to get into this dangerous area of not being able to case select properly. And I think with implants and ortho, the problem that general dentists have is they can get into a bit of a rut, and they can be in this gray area of case selection where they say, look, I think this is just within my scope. I think I can handle this. This is a moderate case, but in reality, because they may be underprepared or might not be fully abreast of case selection, they may misinterpret a case, and it's something they should actually be referring out rather than taking on. And that's where trouble can land. So for myself, I specifically said, I don't really have an interest in ortho. I've got a fantastic associate team where I've got two experts that have been doing ortho for quite a long period of time. So I specifically said, look, I'm not going to go down that road. One, because if I did it, I want to go the full way and actually take on all cases. But two, I don't have the mental capacity to master implantology and ortho. So, I mean, I have the luxury of a team that can support me with ortho.
Yeah.
But I do know some very talented dentists that actually have mastered both realms, and that's incredible. But for me, I could only master the one for now.
For now. So, okay, we've decided we're going down the path of implantology and we want to master it. You start at, with Ken's program, but that doesn't stop there. So where do you go from there?
Yeah, fantastic. So I didn't reinvent the wheel, I must say. I literally, I just look at the greats and what did the greats do? So Ken Lee was just fantastic, but he said, look, if learning doesn't end here, right? The next step is some sort of postgraduate work. And in Australia, there's great programs. Internationally, there's great programs. I specifically just copied what Ken did, and Ken did the Master of Science in Oral Implantology at Goethe University, and that's in Frankfurt, Germany. So it's a 2-year commitment. There's a bit of literature involved, like a bit of a thesis that you have to undertake.
Just a bit.
yeah. Luckily, I did this before kids. So, but again, that was groundbreaking for me from two aspects. One, obviously, the content of the program is incredible. But the people you did it with, some of the people in my cohort were actually max facs already, or were prosthodontists already. So
Wow.
I equally learned as much from my mates on the lunch breaks or at dinner as I did during the day during lectures. So I can't speak highly enough of that program either. But the second thing, of course, that gives you is giving you proper accreditation, letters after your name. I'm not going to say patients seek that, but it does give you a level of security or confidence with patients that they say, okay, well, this guy is, separate from, the majority of general dentists out there. I feel safe with him.
Yeah. But I mean, that wasn't the only thing you did, right? I hear that you've done the ITI. Is it the ICOI as well? Are you doing this all in the space the same 2 years that you're tackling the masters?
Yes, yeah. I mean, it's pretty exciting. Like, there's just so many opportunities out there to gain these special interests, and like there's different fellowships. Like the ICOI, so the International Congress of Implantologists, is a very supportive cohort of lecturers and clinicians and academics. And there's different qualifications you can get through them. So with mine, luckily I could gain what you call a diplomat status, which again, like a lot of the greats have it. And it's just lovely for patients to be able to see that you can put the time and the knowledge into that area. And then the ITI, the International Team of Implantologists, is just another group of academics and clinicians that's very supportive, great study clubs as part of the organization. So the more you can be involved, like you're just a sponge, like just the more you absorb, the better. I personally, I believe in curiosity. So just always, the learnings of today are probably going to be the errors of tomorrow, is what a great man once said. One of the academics that go to university, and it's so true, is literally, you can't be stubborn and stick to your learnings of today, because they're always changing. So learning never ends. We're always progressing.
Yeah. I mean, I think you hit the nail on the head. Like I was going to say, what a common question I usually ask guests, what kind of advice would you give to someone who's just starting their dental education? So to your point, I guess.
Yeah.
So, okay. Let's just put things into setting again. So you've graduated, you've worked at a dental clinic, right? And in which case you're also in the program for Avenue Dental, the Australian Dentist Program of the Year, recent graduate of the year. You're learning from them along the way, and then sure enough, an opportunity arises, and then you get an opportunity to join the team. You join the team, and then you're learning, one, full mouth, and then two, you're doing dental implants, right? But an opportunity, you were saying, comes about where it's like, okay, about ownership kind of comes on. For a lot of our clinicians, they reach a point where they're contemplating about practice ownership, being a specialist or being a super GP, or even starting a family. What are your thoughts, and how did you kind of go about there?
Yeah, great question, mate. It's a deep one. Bit to unpack.
It's loaded.
Yeah, that's good. There'll be lots of opinions on this, I guess. My philosophy, again, I know I'm repeating myself, but beginning with the end in mind. So for myself, I knew that I wanted to be a general dentist specifically, because I still wanted to do cosmetic work, full mouth rehabilitation work. So I wanted to be a general dentist. I wanted to really focus on implants, and I had the game plan set out for that. Becoming a practice owner, I'm not going to lie, that actually wasn't on my agenda for a little while, because again, university at my time sort of drilled into us, don't even think about that. Like, it's not on the horizon. You got to do your time. You got to get experience, usually 5 to 10 years, and then start to look at owning a practice. So really the opportunity arose because Avenue Dental is locally owned. It's not a corporate organization. It's owned just by local guys on the Sunshine Coast. And it was just expansion. At the time we had 3 dental practices, and now we're 7, growing to 8, and then 10 in the next 2 years. And it was just the timing. So the opportunity came up. They identified myself as being a good candidate for that. And I just said, yes. I didn't actually wait. I just said yes. And then
what do I sign?
Yes, yeah. But then I said yes. But yes, how do we do this together? And I suppose the difference and the opportunity that I had is different to what most dentists in Australia would have, in that most dentists would probably buy a dental practice from a retiring dentist or someone stepping away, stepping down, etc. And usually, I'd say they'll be in a single partnership or solo running that practice. And I can't imagine that. I think it would be very daunting. I personally would not be able to run a practice solo. I think it's it would take a lot of time, a lot of effort, and the fortunate aspect that I have is I run in a partnership with two fantastic co-owners and colleagues and friends, and we have clear processes, clear systems that were successful from the get-go. And it was not something where I was thrown in the deep end. I was supported. I was taught everything, whether it comes from business, the marketing, or the HR side of things. I was taught everything and supported. So it was a unique opportunity. I don't think that comes up often, but if that ever does come across any of our listeners, that sort of an opportunity, a supportive co-ownership relationship, I can't speak more highly enough about it. It was a game changer for me.
Yeah. So, I mean, talk to me about, what are some of the biggest challenges that you faced being a co-owner, and how did you kind of overcome it?
That's a good call. I'd say for myself, the obvious thing is becoming a principal dentist or an owner earlier than average. I'd say was tricky because I was trying to master just general dentistry, whether it was cosmetics, implants, or crown and bridge work, at the same time as learning ownership of a dental practice. So the business, the HR, the marketing side of things. It was a lot to take in, and it still is. Like, we're still learning.
This is when you're second or third year out of uni right now?
This was second year.
Yeah.
Second year out. So I'm not going to say I was successful from the get-go.
Exactly.
Massive learning curve.
Yeah.
But I still look back and I don't regret anything of it. Some of my best memories are from leading a team, good mates. It's a second family. It truly is. You don't become an owner for finances. It's like becoming a specialist. You got to do it if you love working with people and you love growing a team of people that share your values and beliefs and you're in a common goal. There's no other reason to do it.
Yeah.
But yeah, the timing of it, earlier than average. When it comes to the family side of things, so that was the other half of your question.
Yeah.
My wife and I, we wanted to be, I'll say younger parents. So, and that's a vague definition, but I mean, I'm 32 this year, and
still young, mate. Still young.
No.
I'm 32.
And we've got three kids, just under 3, and it's a massive curveball. Like, I can't say I could have done all this study whilst having these kids. I must say that. So I did manage to finish up the heavy study right before we had our first child. So having a family is definitely a full-time job. I know everyone says it, but like nothing can prepare you for it. It is like the most rewarding thing ever, but it is honestly 10 times harder than any implant case I've ever done.
Yeah, I mean, because how do you kind of balance it all? Obviously, I'm sure the newer ones that are coming out, because there's a growing number of female graduates now in the dental space, right? And for them, one thing that they have to really consider is that family aspect. For someone such as yourself, who really were young parents at the time, I'm sure they would be leaning on you for advice on wanting to be a great clinician, trying to achieve all these goals, but also being a really successful parent as well. So what would you say to that?
Yeah, great question. I think for myself, I'm a big goal setter. So I've got goals that outline the next 3 months, the next 5 years, and then the next 25 years. So again, beginning with the end in mind. So for people that are coming out into the industry, identifying what they want in their career and trying to see as far ahead as they can and setting goals for that, and then taking baby steps towards that. That's for their career as well as family life. So when do you envision being a parent? Some people naturally want to achieve quite a bit first before going into parenthood, and I can understand that. I don't think I could have achieved as much early on whilst being a parent. It is tricky to balance, but then again, I couldn't see myself being a an older parent either, because you need the energy to run around after the little ones. So it's a balance. But as far as working that out, trying to see where you want to be, where's the end result, and then work backwards from that. And it's a balance, of course. Some people are going to pick career and place having a family second, and vice versa.
Yeah, I want to say for our listeners, Dr. Johan, he himself, recently had a new family member to the family as well. So, congrats to that.
Thanks, mate. Yeah,
and him taking the time aside to come on this podcast to have a chat with us. Thank you so much for that.
No, I appreciate your time, mate. Thank you. Yeah.
So, okay, how do you go about, because everyone's got their own flavor to everything, all right? So how do you go about building your team of staff and associates? What qualities are you looking for when you're hiring new employees?
Yeah. Oh, okay. Well, I guess Avenue Dental, not just my practice, but all of our practices, we have a set of core beliefs or values, and we have a vision. And our vision is to positively change dentistry in Australia. And we are quite serious about that. That's not just a slogan we slap on, the banner of our practice. That is something we live by. We actually bring up on a daily basis with our team. So when it comes to hiring and later on training, every member of our team, dentists as well as support staff, we hire based off beliefs, okay, and values, and do they align with our values? So we may not necessarily want the most experienced dentist to come onto our team if they don't actually align with our values. If all they're caring about is, pumping patients, just getting things done, and not building rapport and giving the best ever experience possible, well, we may not actually want them, okay? We have had a lot of success with hiring recent graduate dentists, and it's because of what we provide. Touring is dedicated on a weekly basis. So time is set aside on a weekly meeting schedule for all of our dental team members. So no one's excluded, myself included. I have a coach myself, and a 1 hour of dedicated coaching per week, and that's covering clinical as well as communication, and in some aspects personal development as well as business and practice ownership if the person is interested in that. So I think we attract a lot of dentists because they actually seek that mentoring. And when we say mentoring, I think there are different definitions. Having another dentist in the room that you can, grab at the end of the day, that could be mentoring for someone, but really mentoring for us is, again, goal-based, dedicated hour meetings week on for every single dentist. That's mentoring for us.
You beat me to the question. I was going to ask you what's your mentoring style, but I think you already said it.
Yeah, well, I guess, mentoring style is we do follow a structure. We have a lot of resources that we give our dentists that cover cosmetics, full mouth rehabilitation work, as well as all general dental procedures. Yeah. But the core of it is just goal setting and supporting dentists fulfill their goals that they set in a flexible environment.
So you're saying you assign someone to that particular graduate if they're interested in a particular line of aspect of dentistry? Is that what you're saying? Or
yeah, close. Essentially, every practice has a principal dentist. So in my case, I'm the principal dentist of the Maroochydore branch, and I've got my team of associate dentists, and I have coaching with them weekly. Okay, and when it comes to goal setting, we brainstorm ideas and we give them advice as to where we should direct their coaching, and we help them crush their goals essentially. But we provide resources as well, so a lot of basic general dentistry framework resources that surround, again, full mouth rehabilitation, crown and bridge work, cosmetic work, a lot of communication tools. So we do quite extensive training in communication. And fantastic results. Yeah, really fantastic results. And we've grown from, when I joined Avenue Dental, we were a team of maybe total dentists about 12, up to now close to 45 dentists. So yeah, it's very exciting.
So, obviously, some associate of yours might be like, okay, I want to learn about ortho. And you might be like, I'm not the kind of guy for it. But what would you do then? Would you be like, here's someone else that is, further down the path of that who can really help you out with it.
Yeah, spot on. So obviously, we can't be the master of all trades.
Yes.
Well, I guess some people can be, but not myself. um, in those situations, ortho and implants, we can support their coaching, and we've got different team members that we can direct associate dentists to gain mentorship from. But inevitably, we strongly encourage those team members to seek postgraduate study. So I'm not saying it's 100% requirement, but you'll find that the majority of our team members that provide either of those two modalities have either got postgrad qualifications or are undergoing that.
Yeah. So I mean, I could be saying it wrong, but would you say that, as much as, you guys might be supporting, offering the support for them, they themselves also have to demonstrate that they need to go out and, educate themselves and not be solely reliant on the practice to give it to you?
Yeah. I would say for purely the dentists that want an advanced scope in terms of ortho and implants, that's when we're going to advise them to look externally for programs. But when it comes to providing support and resources for anything a general dentist can do, up to full mouth rehabilitation work, dual arch, crown and bridge, veneers, we've got the full support and resources for that. And that's something you don't necessarily have to look externally towards. I mean, I did by doing Lincoln Harris's programs, but I would have been fine under Avenue Dental's resources and training as well, just as well.
Yeah, you changed it even more once you joined, hey?
Yeah, that's right.
So let's talk about this, right? So, you're a lecturer, you're a mentor on the program, you run your own, DIO implants introductory course as well. These are all very exciting titles, but what does that involve and what kind of achievements are you so proud of so far?
Oh, sure. Oh, that's yeah. Oh, I'm not used to talking about myself. So, my greatest achievement, or what I'm most proud of, honestly, it's being a dad. not to get on the mushy side of things, but being a dad is by far the hardest thing that I got to grips with, and you can never be a master of being a dad, but I'm getting better and better as each day goes by. But I'm very proud of being a father, actually, and it's my wife is incredibly supportive, and she's allowed to me to focus so heavily on my career. So hats off to my lovely wife, Brittany, who's going to be listening to this. But in terms of my clinical career, what I'm most proud of, I think being a practice owner actually is incredibly rewarding. So as much as I could focus on the clinical, the implant side of things, seeing a practice grow from a small form to a large family of people that you care about and respect you, and you respect them back, that is really rewarding. It does bring up the same emotions as having your own family. You really form a strong bond with them, and I really think it does come back to the values that align. We have people in our team that believe in the same common goals that I do, and it's a very, very strong bond that you form with that team, and that's probably my biggest, most proudest achievement that I can think of, is growing a team with the support of my co-owners, and growing a second family.
But you know what? No family is all, roses, right? There are times when it's kind of like, your siblings just don't kind of get along for different reasons, I mean, how do you kind of bring it back and just kind of realign you guys are on the same page of trying to achieve the same goal?
Yeah, no, that's it's difficult to answer that in brief. I mean, I'd love to have you for a day at the practice, mate, and you can just soak it in. But I could do a little plug here about Avenue Dental, but we were awarded the most the best workplace in Australia 3 years in a row as part of this this award program, the best place to work in Australia, and that's not something easily achieved. Like it comes from values and forming a culture, and when I say culture, it's not just taking the team out for a couple of beers and a pizza on a Friday night. Like it's putting the effort in on a daily basis. It's setting goals with every single team member. It's every team member having a coach. It's having systems and processes so that when you have a new staff member, they don't feel like they're just jumping into an open ocean. They feel like they're
Alone.
supported.
Yeah.
And it's making reference to those values that we live every day. It's something where whether I'm at work or I'm at home, I feel like I'm living. There's no sigh of relief when I come home from a day of work. It's just you're living all the same. It's a pleasure.
So who's your coach to being a great parent?
Oh, yeah. That's a good one, mate. Well, I've done a lot of reading, both in terms of like personal development, but also parenthood.
Yeah.
So there's some great books out there. But a lot of my mates are actually, like, my co-owners are parents themselves, and I've had a lot of deep conversations going into parenthood with them, and getting advice from them. But also just learning as you go as well. I mean, there's some things you can't be prepared for going into parenthood.
Yeah.
I think clear communication with your partner, in my case, my wife, that allowed us to navigate the treacherous waters. But clear communication and expectations going into raising a family is important.
Yeah. No, that's fair. So which brings me to another question, which is, who's been pivotal in your career path and why?
Yeah. That's a good one. Honestly, you never forget your first mentor, and that's they hold a special place in your heart. It's it's like your first love in a way, isn't it?
Yeah.
My first mentor was my co-owner Steve.
Yeah.
And then subsequently my other co-owner Eli from Avenue Dental. Steve places implants himself as well, and he was my first clinical mentor that really opened my eyes up into the what's possible in terms of learning, but at an advanced rate. So doing procedures that I thought I'd have to wait 5 years to do. Also personal development. So I didn't really have any exposure to personal development or bringing out the best version of myself or clarifying my personal values. And he was a big had a lot to do with that. So without a doubt, hands down, that he was my biggest mentor, and still is.
Do you want to give a special shout out to Holly, your nurse?
Yes, yeah, most definitely. Yeah, Holly. Yeah, she's my superstar nurse. Yeah, she's incredible. We've worked together for a number of years, and sadly she's going off on maternity leave soon, actually. So I'll be a bit lost without her.
You'll have to share some words of wisdom with her, hey?
Yes, yeah, most definitely.
So has there been an interesting case that you've ever worked on where you actually, and what did you learn from it?
An interesting case, yeah. I think luckily with implantology, as I was learning the different procedures and as I was advancing my scope, naturally patients were seeking me out for those procedures, which was perfect timing. So I never had an instance of I just finished an implant course and then someone walked in wanting full arch of implants and all on four. That never happened to me, luckily.
Yeah.
I always came back from an implant program and someone had a case of like a lower molar missing molar, something which is a standard classification of an implant. And that was good because it supplemented my learning really well. I suppose the biggest eye-opener for me was when I did start doing full arch therapy work when it comes to implants. So your typical all-on-four case. And when I first undertook these cases on, massive eye-opener, but incredibly thrilling and life-changing. So I'll never forget the first one I did. It was absolutely life-changing for the patient. Patient was incredibly supportive and fully abreast of like where I was at in my journey as well, but fully supportive of me doing it. And it was an incredibly great result. And we reviewed her recently, and it's been about 7 years in her. She had all on 6 on the upper jaw, and fantastic, healthy, very happy, and that was really rewarding. I learned a lot from that, and I could help future patients from those learnings.
Yeah. Well, look, it's one thing to have all the theory, right? And then the next thing is to apply it. But when you're going and you're leveling up to that extent where maybe it might be out of the realm of, or maybe what your normal practice does, how do you kind of ensure that, you're you're best prepared for that situation.
Yeah, that's a really good one, mate. I find it's easier in your early days. So in the early days, when where your scope is fairly limited, everyone's on the same level playing field as yourself, and you can reach out to the colleague next, in the other room, in the other surgery. That's easy.
Yeah.
Or, you bring it to your coaching sessions that we have each week. But as you get through to more advanced scope, that ability to seek information does become slightly narrow or harder to find. For example, if you're doing like all on four cases and something abnormal happens, something you don't recognize, there's people you can reach out to, but it is narrower, of course, than when a class 2 filling doesn't go the way you want it to.
Yeah.
So for myself, honestly, the Instagram community has been a game changer for me. So as much as I can say my programs have been beneficial and everything, they form the core of that. But what helps me level up, I'd say, from the advanced scope, treatments that I provide, the Instagram community has been incredible. And a little bit different to Facebook. Like Facebook tends to be a little bit more protective of ideas and knowledge, but I find on Instagram, the surgeons on there are just so humble and so willing to freely give information and help others grow. And I've really enjoyed becoming a part of the Instagram community. I think I started maybe a year or two ago, and I've tried to give a little bit back as well in terms of knowledge to the dentists on there. But what they've given me is tenfold more.
Yeah. I mean, I will admit it, if you get a whole bunch of DM messages now, you asked for it. Yeah.
yeah, I think so.
So, I mean, do you think any part of, your past as a tutor at UQ or, tutoring for high school or primary school students had anything to do with how, looking back now, you're a lecturer and a, mentor out there now?
Oh, okay. Yeah. Look, that's a tough one. I'd probably say I never envisioned myself to be like a lecturer or even a practice owner, to be honest. So looking back, if I was in dental school or even high school and I had a preview of where I am now, I'd probably say, I don't know if that's realistic or if I, that's going to happen. It probably would be a bit of a surprise for me. I think what I do now honestly comes down to my mentors, and my mentors supported me to get to where I am. Everything I achieved, we can say is comes from within, but ultimately it does form from a trusting, supportive relationship, and that's from my mentors at Avenue Dental, but also the people that I've learned from in the programs that I mentioned.
So, I mean, like I said, we all have struggles, at some point, in our dental journey. Have there been other ones that, we haven't mentioned so far that some of our viewers might not know about?
Yeah, struggles. And if I was to clarify this question, Laurence, would you say struggles purely clinically or more so
I'm happy to go either way. We've had guests come on and they've talked about, how they maybe, trying to find that balance or, in their journey in terms of maybe when they're trying to get into Australian, to become a dentist through the ADC, or whether it be through a tough case that they came across, or whether it be through just mental health in other aspects, or even, dental legal issues where I've had people talk about and openly talk about their own experiences in regards to it. So it's, whatever you are willing to share with us,
That makes a lot more sense. Thanks, mate. I'm a home points here actually. So I think physical health is one of the points I'd bring up here. Is obviously our back and our posture and our neck is something we all suffer from. Something I've always done from a young age is weight training, and what comes with that is flexibility and stretching and physio work, and that's something I've done on a daily basis, and luckily that's kept me very healthy and happy physically in the profession. So in terms of some of the things I've seen other dentists really struggle with is just that physical health. A lot of my associates have to see physios regularly, more as a reactive, sense to an injury. But I think being proactive, so always moving your body outside of work, and that can be anything from walking to stretching, physio, whatever they deem good for them. For me, it was weight training. And I feel really fortunate that I haven't had major injuries, and I really feel it's because of that proactivity there. Mental health as well. So probably the challenge for myself in the first 2 years when I was upskilling at a fast rate is, the mental toll is you're doing procedures that are quite scary initially. And that can be like anything in life. Learning to drive a car. When I first hopped in the car, I was scared out of my mind. I had no idea what I was doing.
Everyone get off the road.
Oh, I can never forget the first time. Actually, it was horrible. But dentistry is the same, and dentistry can be very isolating as well. So again, being in a practice where you have a mentor or a coach, not where you can just call them in, occasionally, but where you have dedicated time to talk to someone, whether it's a mate or another clinician or your partner. I think someone to talk to routinely is important. Not to offload, all the troubles at work, but just to open up and just say, hey, look, feeling a bit vulnerable right now. I just need to, bend your ear for a moment and talk about it. And of course, I've always had that both with the mentoring, but also the relationships around me, and that's kept my mental health quite strong. But there are always points where you come home and you bring work with you. That's inevitable. I don't think anyone can avoid that completely. Again, be proactive. Other challenges. People will often talk about work-life balance in dentistry. I'd sort of challenge that question, work-life balance, because for me, it's not about finishing a day of work and then, as I said, walking home, and walking through the door and sighing and say, oh, okay, I'm finished. Now I can switch off. I think you need to find that workplace where you don't have that moment of transition, where whether you're walking into work or you're walking out of work, you feel the same. That's important. So when people say work-life balance is a struggle, typically in dentistry, it could be a sign that either that culture is not for you, or you need to work on your mindset, or work on cultivating a mindset that's going to improve your perception of things and sort of fizzle out that idea of work-life balance.
That's fair enough. So, again, a lot of our listeners are young and hungry dentists. They want to achieve large goals. So what would if I could ask you, what would success look like for you in the future? What would that be?
Yeah. Okay. Oh, that's great, mate. Well, I could probably answer this by referring to some of my long-term goals. And for myself, some of my long-term goals is, to grow a happy, healthy family, and to have the 3 children that I do today, but to personally pass on like my set of values to them, and sort of nurture their like a positive mindset from them in the future. So that's what I have for my family in the future. That's successful in terms of the family outlook. In terms of my career, I have a goal to sort of give back as much as I can, because I've received so much in my career within Avenue Dental, but also external. So, whether it's running my program or giving back through the Graduate of the Year program that we run each year, or just through Instagram, trying to give back as much as I can to the industry. That's something that I see as a form of success. If I can have an influence on a number of dentists in our community, I'd see that as a success. And then I suppose patience as well. So if I can have meaningful relationships and long-lasting relationships with the patients that I help, that's something that makes me sleep well at night. That it brings the emotion into your work and gives you purpose. So I have found that. So I can truly say I am happy and I love what I do, whether I'm at home or at work. I am happy, and I'm sure a lot of dentists have that, but if you don't, try and seek that in one shape or another. I think it's important.
Yeah, no, that's fair enough. I mean, there's a lot of other questions I want to ask you, but to kind of wrap it all up, do you have any wise words of wisdom for the budding young dentist, and what you think are the key skills and attributes that they should be focusing?
That's a good question, mate. I think there's two ways of going about it. One is being open and honest with the patient. So sometimes for our associate dentists that are doing the first, let's say, set of veneers, being honest with the patient and saying, look, this is something I'm trained for. This is something I'm doing. Are you okay with me doing this? I'm happy to do this case at just the lab fee, for example. And I take lots of photos. We document this case so that I can benefit future patients. Being honest with patients and communicating in that way might help you actually sort of tackle these cases. Otherwise, if a case is truly not within your scope, refer it to someone who can do it, but then ask that person if you can actually participate in some way with the surgery, or whether it's assisting or actually doing it with them, alongside them. Using those two will eventually get you to the point where you can actually get hands-on experience one way or another.
Yeah. I mean, I've had it in my own experience where I've had a difficult endo case and I wondered, how does the specialist going to tackle this case? And I would go on and refer it, and then I would, follow it up with the, and then attend and watch how they actually go about doing it.
Perfect. Now, that's unreal, mate. I mean, not everyone's as proactive as yourself, but yeah, that's the way to.
Yeah. I mean, when you're young and you've got time, that's the time to do it.
100%.
I mean, there's a lot of other questions I want to ask you, but to kind of wrap it all up, do you have any wise words of wisdom for the budding young dentist, and what you think are the key skills and attributes that they should be focusing on developing?
Yeah, okay. I know I'm a broken record, but from habits of highly effective people, begin with the end in mind. Okay, and that's for any aspect of life. If it's personal, if it's for your career, relationships, what do you want in the future? And that could be in 10, 20 years, whatever, but identify that as early as possible. Okay. And for me, clinically, that was implants, and I made steps towards that. For our listeners out there, it could be practice ownership. It could be being the ultimate general dentist, the master of all trades, but identify where the end is for you, and strive towards that.
Yeah. Wow. So, I mean, we were asking a few guests, we were asking, our community for questions, but we came on this very peculiar non-clinical question, which was, they wanted to ask about your AP watch. And I see in the back, you've got a collection in there. I mean, for our listeners, you probably can't see it, but for our viewers, he's got a collection in the back there. But it must have been maybe when you're taking photos, or there was a post up online or something like that about the AP Royal Oak one or something.
Oh, yeah. That's right. Oh, look, I suppose everyone's got their hobbies, hey? And for some reason, dentists usually it's either watches or cars. It's usually one of the two. Now,
or golf.
Or golf, yeah, that's true. Now, cars, I don't care about cars at all. Like, if I can get to work, I'm happy. But watches is just a bit of fun, yeah. So yes, I do collect them. I trade them. It's a bit of a community out there when it comes to watch trading. So everyone's got their vices.
That's so true. So, Dr. Johan, thank you for coming on the show today. If you could let the people know how they can find you. Yeah,
perfect. So if you're interested in Avenue Dental, of course, just search us on Google. We'll be quite high up on the Google rankings. Instagram, so Dr Johan Weemaes, you can search that. Yeah, that's it.
So for our viewers, if you like this episode, drop a comment below on your favorite part, but don't forget to like and subscribe, and we'll see you in the next episode of CPD Junkie Podcast. Thank you.